طلاب محاضرتنا لهذا اليوم deal with a very important subject, which is the physiology of a different disorder in the gastrointestinal tract. And first we are dealing with the paralysis of swallowing mechanism. And as you know, the swallowing mechanism is a very complicated mechanism. Any damage in any part might affect swallowing. Damage in the cranial nerve, the 5th and 9th, 10th cranial nerve can cause paralysis of the swallowing mechanism. Also, if there is a disease in the central nervous system, like poliomyelitis, encephalitis, or a disease in the brainstem, damage in the brainstem by itself, or if there is a defect in the neuromuscular junction, like in myasthenia gravis, or if there is paralysis in the muscle of swallowing, like in muscle dystrophy, all these affect the swallowing. The swallowing either be completely absent, completely abrogated, or partially, or sometimes causes failure of the glottis to close, which might causes the food passes to the trachea instead of passing to the pharynx, or it might causes a failure in the closure of soft palate and uvula, and in this case the closure of the posterior nerves is not occur, and the food passes into the nose instead of passing to the pharynx. A most important subject regarding the paralysis of swallowing is that which occur during the deep anesthesia and the patient is on the table, and because of the anesthesia there is paralysis of swallowing mechanism. So sometimes vomiting of material from stomach is occur, and instead of passing to the pharynx it passes to the trachea, and in this case it might cause choking or death of the patient. The other subject is what we call achalasia or mega esophagus, and this condition is occur when there is paralysis or damage to the myenteric plexus. And as you know, myenteric plexus play important role in peristaltic movement, initiation of peristaltic movement in the gastrointestinal tract. And if there is a damage in the myenteric plexus of the esophagus, so peristalsis will not occur in the esophagus. And as you know, when the peristalsis reach the lower end of esophagus, there is a receptive relaxation in the lower esophageal sphincter in order for the food particles to pass to the stomach. So a failure of the receptive relaxation in the lower esophageal sphincter, which means that this sphincter remain constricted, leads to accumulation of the food particles in the esophagus, and with time the esophagus become dilated, and the food particles which remain in the esophagus causes excoriation of the mucosa of the esophagus, and inflammation also occur and lead to ulceration of the esophagus. And if this condition is not treated, it might causes esophageal rupture. And the treatment of this condition is by putting a balloon in the lower esophageal sphincter in order to make it relaxed, and the food can pass easily to the stomach, or it might be treated with drugs which causes relaxation of the smooth muscle in this sphincter. The other subject is a disorder in the stomach, and we have many disorders regarding the stomach. First, we have inflammation of the gastric mucosa, which is we call gastritis. And in gastritis we have two types. The most common type is mild to moderate chronic gastritis, and this is occur usually in the middle or later years of life. And the inflammation in this case is usually it is a superficial inflammation, and not causes harm to the patient. But if the inflammation is not superficial, it is a deep inflammation, it might cause damage to the gastric mucosa, and in long standing cases it causes atrophy of the gastric mucosa. The other type of gastritis is acute and severe gastritis, and in this type we have severe excoriation and ulceration of the gastric mucosa, and it might causes excoriation of the gastric mucosa by the gastric secretion itself. The causes of gastritis are two causes. Number one is due to bacterial infection, and this can be treated by antibacterial therapy, or it might be caused by ingestion of irritant substances like alcohol or aspirin. The outcome of this of the gastritis, we have in gastritis, as you know, there in stomach we have what we call the gastric barrier, and by the gastric barrier we mean two important things. Number one, we have the mucus, and as you know, the mucus is secreted by many gastric gastric gland, which is responsible for the secretion of this mucus, and it forms a thin shell around the wall of the stomach, and this mucus play important role in protecting the gastric wall. The wall of the stomach by itself is protected by this mucus, because this mucus is viscid mucus, and it will adhere to the wall of the stomach, and protecting it from the harmful effect of gastric secretion. Also, this mucus is alkaline in nature. The other protection of the gastric wall is by the adhesion of the between the epithelial cells, and this adhesion of the epithelial cell also forming an important barrier. So any defect which might cause damage to this barrier, the mucus and the adhesion between the epithelial cell, as we said, there is a tight junction between this epithelial cell. So any defect which might cause damage to this barrier, it will causes the permeability of the gastric secretion is increased. It can penetrate through this damage in the barrier, so it can harm the gastric wall or the gastric mucosa, and by time it causes gastric ulcer. Also, if in chronic gastritis, due to damage in the gastric mucosa, gastric atrophy is occur, and in this case, a damage to the different type of cells in the stomach. And as you know, we have the parietal cell, which secrete the hydrochloric acid and the intrinsic factor. This cell might got damaged and causing pernicious anemia. The other important subject in the disorder of the stomach is the peptic ulcer. Peptic ulcer occur because of imbalance which might occur between any imbalance between the gastroduodenal mucosal barrier or neutralization of the gastric secretion by the duodenum can cause peptic ulcer. The gastroduodenal mucosal barrier, as we said, is made by the mucus and the tight junction between the epithelial cell of the stomach. So, if this barrier is lost, it causes peptic ulcer. As we said, a damage in the mucosal barrier causes gastritis, and gastritis, if stay for a long time, it causes peptic ulcer. Also, a neutralization of gastric acid secretion. As you know, the duodenum play important role in neutralization of gastric acid secretion. How? As you know, we have the neural and hormonal control of the duodenum. We call it enterogastric reflex, and by this reflex, when the food reaching the duodenum, it causes signals, either neural or hormonal, sent back to the stomach in order to inhibit the gastric emptying, and we call it a we call this a gastroenteric reflex. This is under neural and hormonal control. If this reflex is by a reason or another is defected, so the gastric emptying will continue, and by this it might cause peptic ulcer or duodenal ulcer. Also, as you know, we have a very important hormone which is called a secretin hormone, which is released by the upper small intestine, and the role of this hormone is to stimulate the pancreatic secretion, which is rich in bicarbonate, which play important role in the neutralization of the gastric secretion. So any defect in the this hormonal secretion, so that the pancreatic secretion, which is rich in bicarbonate, will not occur, and the acidity of the stomach causes a damage to the stomach itself and to the duodenum. We have a specific cause for the another specific cause for the peptic ulcer, which is due to bacterial infection, and there is a type of bacteria which is called Helicobacter pylori, and this type of bacteria it's found to causes damage to the gastroduodenal mucosal barrier, and also it causes increase in the gastric acid secretion. So infection with this type of bacteria can cause peptic ulcer. Also, if there is increase in the gastric secretion, any condition which causes increase in the gastric secretion, it causes peptic ulcer, like in psychological disturbances. Also, it might increase by smoking. Smoking by itself also increase the stimulate the gastric acid secretion. Also, alcohol causes damage in the barrier of the mucosa. Aspirin is a strong or other non-steroidal anti-inflammatory drugs can cause damage to the barrier, and the treatment is by giving antibiotic if there is a bacterial infection, or by giving drugs which suppress the gastric acid secretion, or sometimes we need surgery. The site of the peptic ulcer, usually it occurs in the pyloric end, or sometimes occur in the within the lesser curvature, or in the cardia, or sometimes occur in the wall of the stomach, and it is called marginal ulcer. The other subject is a disorder in the small intestine, and we have abnormal digestion of food in the small intestine, like that occur in the pancreatic failure. As you know, the pancreas play important role in the digestion of food because it secretes a large number of enzymes. So any patient with pancreatitis or a blockage of the pancreatic duct by a stone in the papillae of water, or a disease in the tumor in the head of the pancreas, or after surgery removal of head of pancreas, all these factors can cause a defect in the function of the pancreas. And as you know, the pancreas secrete a large, as we said, a large number of enzymes like proteolytic enzyme, trypsin, chymotrypsin, and carboxypolypeptidase, or pancreatic amylase enzyme, which play important role in the digestion of starch. Also, we have pancreatic lipase, which play important role in the fat digestion. And without these enzymes, about 60% of the digestion in the small intestine may not occur, and also the absorption is affected. Without these enzymes, the absorption in the small intestine will not occur. Also, the absorption of carbohydrate and protein is affected. Regarding the pancreatitis, which is inflammation of the pancreas, we have two types, either acute pancreatitis or chronic pancreatitis. The most common cause of the pancreatitis is either drinking alcohol or blockage of the, as we said, blockage of the pancreatic duct by a stone in the papillae of water. And presence of a stone in the papillae of water will cause the blockage of this part by a stone will causes the pancreas. As you know, the pancreatic cell acini secrete a large number of proteolytic enzymes which are in inactive form, trypsinogen, and when it stimulated by enterokinase, it will be changed into the active form, which is trypsin. And once trypsin is formed, it will activate another proteolytic enzyme. And as you know, we have a trypsin inhibitor. When there is a blockage in the ampullae of water, the trypsinogen, which is activated into trypsin, is exceeding the amount of trypsin inhibitor. So inhibition of the trypsinogen will not occur in the pancreas. So the trypsin, which is the active form, will digest the pancreatic acini by itself. So it will causes pancreatitis. Now the other subject which we deal with the is malabsorption in the small intestine, and the other name is SPRO. We have two types of SPRO, non-tropical SPRO and tropical SPRO. The non-tropical SPRO is also called idiopathic SPRO, or it's called celiac disease in children, or it is in adult it's called gluten enteropathy. In this type, we have some person or some subject who are sensitive to gluten, and when they are eating a gluten which is present in grain, especially wheat and rye, these people are susceptible to develop this type of SPRO, in which there is a damage in the small intestine. And if the condition is mild, we have damage in the microvilli, but in severe cases, a damage involving a villi or in the enterocytes also destroyed. And as you know, the microvilli and villi play important role in the absorption of different type of food, and the first type which affected is the of the food is the fat. So in these subjects, when the villi or microvilli is destroyed, the absorptive area will be decreased. So they will develop a malabsorption. And the other type of supro is a tropical supro, and in this case we might have a bacterial infection, so they are treated with antibacterial agent. The outcome, as we said, of supro, because there is damage to the absorptive surface of the intestine, we have malabsorption. And as we said, the first type of food which affected is the fat. So they will have what we call steatoria, which mean a passage of a fatty stool, because the fat is not absorbed, so it will secrete it in the with feces, and their stool is called steatoria. In severe cases, the malabsorption not affect the fat only, but it will affect the other type of food or vitamins which are or minerals which are absorbed in the small intestine, like carbohydrate, protein. So we have a malabsorption of these protein and carbohydrate, we will end with nutritional deficiency. Also, the calcium is affected, the absorption of calcium is affected, so the patient have osteomalacia or demineralization of the bones. Vitamin K also not absorbed, so there is a defect in coagulation. Also, folic acid and vitamin B12 will not absorb, so the patient will have a pernicious anemia.